Hello, my name is Doctor Robert Antolak, the dentist at thegeneraldentist.com in Shelby Township, Michigan, Macomb County. And what I'd like to do is talk with you today about tooth-colored fillings versus the silver mercury fillings. So amalgam fillings have been around for over 150 years. Amalgam is, in the name amalgamation means it's the blending of. And so amalgam blends mercury, liquid mercury, with silver, copper, and tin in a different combination, and it takes and it compounds this material into a filling material, which most everybody has in their back teeth, these silver amalgam fillings. Amalgam, once again, has been used for many years. It's a great material. It's great for using it for long term. It's like I say, it has a long track record for filling. There are some advantages of using it and some disadvantages, and I'd like to talk to you about that. The advantages of using amalgam is that it's easy to work with as far as the dentist is concerned. It has a long track record, and it works. The disadvantages of using dental amalgam is it contains mercury. Mercury in the amalgamated form in your mouth is a fairly stable compound, but it does break down, and there are mercury vapors that are emitted from those fillings over a period of time. Holistic physicians, if you go in for an exam, they'll check your hair and do hair samples to find out, or blood samples to find out what your level of mercury is in your body. Sometimes if you have lots of old fillings, that can be released, the mercury can be released into your bloodstream, and that can affect your body. Also, one disadvantage of these silver mercury fillings is that they don't look so great. They don't look natural. They turn black, if that's a concern. They also, over time, will actually leak. You'll get the emission of bacteria will get in next to them. And usually with these fillings is that they corrode, and so around the corrosion, it has the ability to sometimes to help slow the process of getting cavities. But many times I have many patients who have cavities underneath these, and they're pretty significant cavities, and you don't even really know that they're there, but it forms underneath them. Silver fillings also can form fractures in teeth, microscopic fractures. And what these do is because mercury has the ability to contract and expand, it will over time expand and actually put stress on the teeth, the surrounding teeth. So therefore, if you're biting on something, it could crack off the tooth. Okay, so those are some of the advantages and disadvantages of amalgam. The advantage of using the tooth-colored composite materials are they are non-toxic, so they do not contain mercury. They bond the elements of the teeth together, and so what that does is it helps to support the tooth and make it strong. Also, they look aesthetic, so they look like a natural part of your teeth, so that's a really nice benefit. The disadvantages of using composite materials is that they do cost more. They take longer to place, they take longer for the dentist to place, and they're more sensitive, they're more technique sensitive. And so what that means is that we have to have the right combination in the mouth to be able to do the best job that we can to make sure that they're not sensitive after being done. But they do last a long time. They're comparable with the dental amalgams as far as wear goes. In the past years, composite wore at a much quicker pace than it does now. So right now, in my mind, in my practice, I do not place dental amalgam because the composite is, in my mind, it's a better material because it lasts as long, it looks great. Also, because it doesn't contain mercury. And I, as a dentist, I do not want to be looking back down in the future and saying, well, I should have put this in because of the issues with the mercury toxicity. The debate. It's a very debatable topic, but in my mind, because it's been banned in some of the Scandinavian countries for using mercury, that's an issue. Another issue I have is that we have to regulate any of the waste of the amalgam that's been mixed already. That has to be regulated waste. And if it's put in the mouth, how can that be congruent with having to go to regulated waste and having us pay to have that shipped out and stored correctly in a certain manner. So there's some incongruencies with that. So that's why I choose to use the tooth-colored fillings. They look great, they hold the teeth well together, they bond together, and they last a long time. So if there's any questions to you that you may have, if you're tired of looking at those silver fillings, you can give us a call at 586-247-3500 or visit our website at thegentlедentist.com. Thank you. Have a blessed day.